we can do better. I have a 7-second short going that's asking the question, should healthcare be a human right? Yes or no? Now, I'm going to let this run for about 7 days and then compile all the results and just get a super simple chart saying, based on YouTube short viewers, what do people think? Healthcare for all, yes or no? This is obviously not a scientifically rigorous way to get the public's opinion. But you know what? All these pollsters don't seem to know what they're doing anyways. And I'd much rather hear from my peers and just figure out what is the pulse right now. This might even capture people outside of the United States. Once again, this is not a scientific poll or experiment. This is just to figure out how we're looking at this issue today. Now, like and subscribe if you want to see the results of this poll in about a week. I'm going to have a little short that I post about it, but I'm also going to make a long form video about it, just to go into a bit more detail about what universal healthcare looks like in the United States and why it's actually much more achievable and affordable than you might think. Now, I have a master's in public health where I specifically focused on Medicaid expansion in the United States through the Affordable Care Act, yes, Obamacare. And one of the most striking things that I learned time and time again is that through the implementation of the Affordable Care Act, we insured more people, more than 20 million more Americans had insurance because of the Affordable Care Act than without it. But then beyond that, we did not significantly increase our spending on healthcare as a percentage of GDP from insuring these people. That means that we literally had our cake and ate it too. We helped people that were sick. We insured kids up to the age of 26 under their parents' plans. Before, if you were a kid coming out of college and you didn't get a job that offered you health insurance, what are you supposed to do? We opened up a market for individuals to purchase insurance plans that were at least somewhat feasible. Now, one of the coolest things that the Affordable Care Act did as well is it prohibited insurance companies from denying insurance to people with pre-existing conditions. Imagine that you have type 2 diabetes and you are in between jobs and need insurance because you know that you're going to have medical costs. In any working healthcare system, you'd just be given your insulin. Insulin costs something like $6 to $8 to produce a month's supply. The patent was released by the inventor of insulin to the public because he thought that diabetes was a disease with a treatment method that was so easy and affordable to make that it would be a sin to not ensure that everyone that needed insulin had it. But what's happened is in the United States, insulin has been taken by private corporations. The government actually sold the right to the patent to private entities. And those private entities now charge upwards of $500 for a month's supply of insulin. Because of the Affordable Care Act, health insurance companies can't deny you for pre-existing conditions. We're all good people. We're all trying to do our best. We care about our neighbors. We care about our community. We care about our kids. We care about our parents. By coming together, we can implement a universal healthcare system that is actually good for the public's interest rather than these private corporations. Now, there's this huge argument that people like to throw out. What about innovation? What about innovation? These private companies deserve to make a buck because they're inventing new drugs. But what's happening in the United States especially is these huge private entities are buying out the small research firms, closing down their new drug research, and only selling the already proven drugs that these small entities were producing. It's the little guy that is actually renovating and innovating our healthcare system and our drug processes in order to make health, or in order to make our society healthy. We can do this. We can't let for-profit entities hire lobbyists with millions of dollars to talk to our politicians about what they want so that our politicians can ignore the public interest. We deserve better than that. A big portion of that comes down to us needing to abolish Citizens United, which was a ruling that essentially said that corporations' dollars are allowed to be used as a method of free speech. In our legal system, we do this weird thing where we say that corporations have all the protections of a human entity in our society. But that being said, corporations kill people on a daily basis, and there is no jail for a corporation that accidentally denied claims like United Healthcare that should have been approved. There's no jail for them. There's no punishment. They're scraping the profit off the top, and it's costing us lives. It's costing us suffering. Now, if you want to see the results of this survey that I'm posting, please like, subscribe, and leave a comment. Do you think that healthcare is a human right? Yes or no? And maybe explain why. I think that it is a dead argument that healthcare should not be provided to every person that exists in the world, essentially, especially in a hyper-prosperous nation. We can come together and make a society worth living in. Thanks. I hope you have a good day.